feeling worried talaga ako that time kasi hindi ko na, nagagawa, hindi ko na napapatest ang sarili ko every monthly. Kaya sa bahay na lang muna, tiis ganda. Kaya natatakot kami makapasitive kami or ano bang sakit na makukuha namin, gano'n. The HIV is also a pandemic actually, and the HIV is starting in every city. So, ipaligad na din ito na dapat din tutukan at dapat din kalagahan ng bawat every health sector. And I think kailangan talaga natin yung it's the reality na tumataas ng kaso.
So currently, yung ating setting in terms of HIV testing and services, ibinabalik natin siya after magkaroon ng ECQ. So may mga konting in terms of foot traffic, pero it doesn't mean na stop yung service natin. So inaano natin siya ngayon, minodify natin para kahit in times of GCQ at kung ano pa mga klaseng GCQ na parating, makakasabay tayo sa service at hindi maiiwanan yung HIV program ng nakahang kasi priority nila yung COVID. So, ganun siya. Walang difference in terms of practice. Same pa din kung ano yung usual. Pero in terms of counseling, napaka-strict ngayon in terms of social distancing and physical distancing. And syempre may barrier din si HIV counselor at si client. Yung barrier is yung ano natin, yung barrier for saliva. Hindi ko alam kung tawag dun eh. Pero meron siyang barrier. May ano siya. At syempre naka-face shield naman si provider at the same time, talagang strictly natin na-require si client na pagpupunta sa facility is kailangan naka-face mask siya. But in terms of community testing for the CBS, wala pa silang specific guidelines. Mukhang naka-status ko mga community-based screening ngayon kasi wala pang clear na guidelines kung paano nila siya gagawin or immobilize.
Mahirap siya in a way kasi wala nang gathering, so wala nang event, wala na rin yung mga pwedeng puntahan kasi nga naka-lockdown. So, mahirap yung pag-web ng client. So, ang ginagawa is through online, walang reach ng lahat. Wala ding testing, walang screening. Ako kasi more on the transgender woman. So, transgender woman lumalabas yan pag may event. Pero mga tao na nag-reach out sa akin online, hirap talaga dito sa Zamboanga na pagdating sa mga online reach. Hindi kasi ganun ka-active ang mga tao dito.
The screening itself has totally stopped at the moment since the quarantine began. It's more like the advocacy is still going on, but right now we are relegated to helping those who have been tested positive or reactive before the quarantine. It is kind of tricky. We are kind of at a loss of how to go about it. The moment those who have been calling us wanting to be tested right away are people who are having symptoms like they've got fever or they've got colds, and one of them said that they have difficulty breathing, and with the pandemic going on, you are at a loss of how to treat this kind of issues because those symptoms can also point towards COVID.
Walang protocol kahit na yung yung parang paggamit lang ng PPE or kahit yung protocol for yung social distancing, So it's lang, parang yung ginagawa is we only goes with the DO or the city health office. So, sa kanila lang kami nakikinig. So at the same time, mayroong mandato ang ASP. So doon kami parang nakikisama or sumasaba. Hindi naman siguro nakalimutan, siguro nakaligtahan lang, thinking na parang kasi nga COVID. So doon na agad yung atensyon, nawala na si HIV. So siguro ganun, nakaligtaan lang. Siguro alam nila na marami nang nag-work sa HIV program. So feeling nila, intindihan na nila yun or alam na nila kung anong gagawin. Parang ganun.
Siguro we should have a black and white. What will be the direction for the new normal ng magiging HIV response natin? Kasi for how many months, we admit na meron naman talagang mga shortcomings during the initial bugso ng epidemic. Medyo napag-iwanan talaga yung program. Pero sana magkaroon ng specific guidelines. Kasi ang lumabas ng guidelines lang during the COVID is kung paano makaka-access ng ARV. But for other services, hindi siya naka-black and white kung ano ba talaga yung protocol na kailangan sundin. So if the national program should create a black and white document that could be followed by other facilities, I think that would be much better. Para hindi rin malilito yung mga access ng service, kung ano yung protocol ng isa, iba din sa protocol ng isa. So uniformity lang naman din.
Yeah, I actually asked one of the DOH employees that is with the HIV program for the region if they have developed protocols for this, because I have seen one account in Facebook that is offering HIV screening. Either he or she, I don't know, because we don't know who owns that particular account. He or she is offering HIV screening, and that account is offering free screening, and then he will have to come to your place to be able to do that. And I wasn't sure if that was safe with the pandemic going on. And they told me that, he told me that they still don't have a protocol yet. And if I'm not mistaken, if I remember it correctly, he said that all screenings, all CBS must stop at this point until such protocols have been formulated or something like that. I can't imagine myself offering that kind of service at this point, because I wouldn't just be putting myself at risk, but everybody who is living in our house would be at risk as well. At the moment, I would put the COVID pandemic at the forefront, because it is more urgent, because people could die in just a few days if they catch it. The question would be if they do provide PPEs for the screeners, would we be using resources that should have been given to frontliners? That's at the back of my mind. Can we wait for such time that a vaccine can be found before we start doing screening or can't we?
Magiging challenge natin dito, lahat ng cases natin, even TB and all lung infections, kinoconsider na siya as COVID suspect. So talagang require sa kanila na may dala sa isolation. Yun yung majority ng legal detection natin kasi is for confinement talaga. So automatically COVID suspect talaga sila as of this time. So they treat as a suspect. At the same time, mahirap maghanap din ngayon ng facilities na mag-a-admit for PLHIVs. Kasi yung isolation rooms natin para nakadedicate specifically for COVID patients. So yun challenge. For those clients naman na kumpleto yung laboratories upon arriving, since our facility is an outpatient service provider, kapag kumpleto naman yung kanilang basic labs, wala namang nakitang ibang existing infection si doc, ini-enroll na natin siya on the same day. So, same employees kasi naman talaga yung direction ni UNAIDS even before na lahat ng reactive clients, they need to bridge on the treatment right away. But for those who are may infection, what our facility is doing is we are doing our best na hanapan sila kung saan sila pwede ma-admit.
At this very moment, there's nothing we can do about late detections, I believe, if it's already there. But I think what the HIV arm of DOH can do right now is really step up in preparing themselves to be able to handle a barrage of late detections once they figure it out how we do screenings from here. Are they equipped and are they prepared to have all those patients come in? At the moment, since there are no protocols yet, it's up to the local facilities to be able to come up with something to still continue what they do.
On my side, ang pina-priority ko yung mga friends ko, ay hindi ako natatakot in a way because I'm dealing with my friends. So alam ko mga friends na yun na wala naman silang symptoms kasi ini-friend ko din sila, tinatanong ko sila kung anong gagawin. Yung mga may lagnat, gano'n. So hindi naman ako natatakot kasi hindi naman talaga siya, Zamboanga is not that high risk pagdating sa COVID. So, nasa moderate lang kami. May mga kaso na gano'n nakakontrol naman sila.
As a personal point of view, in terms of testing, it's a perfect timing for us to act now to combine the service for rapid testing together with HIV tests. There is a local government unit who's pioneering that. At may nakita na tayong gumagawa nito, ang Naga City. They're doing it right now. They offer COVID testing for rapid tests. At the same time, yung HIV test is being offered also dun sa lugar.
Bilang part din ng community and active din ako sa community, so ang ginagawa ko, sumasama ako as volunteer. So with that volunteer, ang nakatayap ako sa SPS. So what I'm doing is, distributing hygiene kit, and then sa hygiene kit na yan, sinasama ko na yung commodities doon. So at the same time, yung mga condoms and lube, mayroon ng access yung mga youth kasi kasali sila sa distribution. Kahit siya ng ayun kita din yung distribute namin.
For other laboratories like viral load and CD4, may mga facilities ngayon na nakastop. Ang reason is, syempre, ang kanilang laboratory is being utilized also for COVID response. Pero sana they will also realize na there's still some programs that needs to be run at kailangan pa rin ma-continue yung service. Ika nga sa HIV, no one should be left behind.
Kung sa mga gusto magpa-test, ay konting pasensya lang po sana that if we can have clear protocols and we can figure it out how to make it safe for everybody concerned. Konting tiis lang po until we can do that.
So we encourage still everyone to get tested for HIV. They just need to coordinate with their facilities, the social hygiene clinics as well, to check kung ano yung perfect time nila naka-open sila at less yung tao. It should not be a hindrance na maka-access sa services in terms of HIV, even this pandemic.
For those people wanting to be tested but have symptoms, I think they should contact those that are in the medical field first before going to screeners, since at this point the symptoms might be posing a risk. So baka pwedeng yung sa mga health centers muna ang kausapin about the symptoms, so they can get tested for COVID first.
We have to capacitate yung mga outreach worker na kagaya ko. Kahit na yung supplying us with the complete care, sa PPE, sa lahat ng supply. Then, siguro din magbigay sila ng tamang protocol. Yung protocol talaga anong gagawin para hindi kami malito kung saan kami pupunta, anong gawin namin. Iba-iba kasi yung rules ng bawat city. So, iba-iba din yung, iba-iba din yung approach na ginagawa. Ganon.
Pwede bigyan ba nila ng pansin ang kagaya ni Mama Jaya na frontliner na handang tumulong at mag-serve para sa community, at saka tip lang kailangan nila at yun lang po ang kailangan nila para makatulong sila sa community at higit sa lahat sa amin na din